any infection, and also adaptive immunity. There is specific response to an infection, which involves the T cells and the B cells. The innate immune response is immediate, whereas the cellular or the antibody response is usually starts from 6 to 8 days. Now, what about vaccine-induced immune response? The vaccine are safely delivered an immunogen, antigen able to elicit an immune response to the immune system in order to train it to recognize the pathogen when it is encountered naturally by activating the CD4 helper T cells that in turn stimulates the B cells to produce neutralizing antibodies specific to the virus, and also CD8 cytotoxic T cells to recognize and kill the cells which are infected by the viruses. So this is a diagrammatic presentation of the vaccine-induced immune response. Now, when the adaptive immune cells, that is the B and T cells, encounter the same viruses again next time, they respond rapidly, and the immune system can effectively clear an infection before it causes the disease. Vaccines use this immune memory to protect us from infection, and the immune memory can result from the prior infection or from an infected vaccine. This is the viral, the amount of viruses, and this is a cellular response after the viral infection, and this is the antibody response after the infection or immunization. When we talk about the vaccine, this vaccine, COVID-19 vaccine, we have 4 types. One is the viral vector vaccine, RNA nucleic acid vaccine, whole virus vaccine, and also the protein subunit vaccine. Now, when we talk about the viral vector vaccine, they are used a non-coronavirus vector which is modified to include a gene that encodes a target antigen. Examples are like adenovirus, the measles viruses, or vesicular stomatitis virus, and can be replicating or non-replicating. The non-replicating, it infects a cell and produces SARS-CoV-2 antigen in the cell, but not new virus. Replicating means it upon the infection produce SARS-CoV-2 antigen in the cell and a new viruses which infects other cells. So the SARS-CoV-2 antigen inside the cell seen by the body as if the SARS-CoV-2 infection, and the induces T helper cells and the cytotoxic T cells. So this is a viral vector, and the modified viral vector replicates inside the body, and the SARS-CoV-2 antigen is produced, and they are represented in the T helper cells, and these T helper cells recognizes the antigen, and it stimulates the B cells to produce the neutralizing antibody. On the other hand, it also gives signal to the T helper cells to activate cytotoxic T cells to destroy the infected cells. Now, how about the inactivated virus vaccine? In inactivated virus vaccine, the genetic material of the virus has been destroyed to stop the disease producing capacity. Inactivated virus cannot replicate inside the body, so higher doses are needed. Sometimes an adjuvant molecule that simulates the immune system is used to help strengthen the immune response. Inactivated virus vaccine generally only induces the antibody-mediated immunity, not the cell-mediated immunity. Diagrammatically, this is the RNA has been destroyed, the inactivated virus, and the antigen-presenting cells, the inactivated virus is ingested by the antigen-presenting cells and triggering the adaptive immune response, and also again represent to the T helper cells, and the same process again signaling to the B cells for antibody production, and also to the T helper cells to recognize simulate the B cells to produce neutralizing antibodies. Now, RNA vaccines. RNA vaccines are antigen coding strands, the messenger RNA delivered inside a lipid cord. Once inside the cell, the messenger RNA is translated, the protein antigen. The antigen is recognized, inducing an immune reaction seen by body as if the virus inside the cell so induces the T helper and cytotoxic T cells and antibodies. The messenger RNA also recognized by cells as pathogens, simulating strong immune response. So this is the messenger RNA encoding SARS-CoV-2 antigen, and the self-replication goes inside the cell, and the antigens are presented to the antigen-presenting cells, and then again to the T helper cells, and the same process which has been going on with the cytotoxic T cells or the B cells to produce antibodies. Now, what about the subunit type of vaccines? They use the antigen of the viruses without any genetic material, usually with an adjuvant to give a better immune response. And they are also made using recombinant expression system made in a cell without using the viruses. With the help of antigen presenting cells, the antigens are recognized by T cell as with a real viral infection. So subunit vaccines generally induces mainly the antibody-mediated immunity. The adjuvant can enhance the antibody response and also the cell-mediated immunity. So this is the SARS-CoV-2 antigen, and they are presented to the antigen-presenting cells, and the antigens are recognized by the T helper cells as with a real viral infection, and also the same process is going on. So the Indiana, among the back. Now, what are the vaccines which are recognized in India? One is the Covishield vaccine, which is manufactured by the Serum Institute of India, and the efficacy is better. The efficacy is 63% overall, and there is increase with a gap in the 2 doses. Covaxin is another vaccine manufactured by Bharat Biotech, and is a whole virion inactivated coronavirus vaccine, and the efficacy is 81%. And there is also another vaccine which is recognized recently in India for use, that is the Sputnik virus, which is approved in April Now, so can vaccine provide long-term protection? We know that the natural 6 to 8 months, but the vaccine-induced immune response is almost same. It is also 6 months. Now, what about the benefit of vaccination? There are two very, very important benefit after vaccination. One is on the prevention of or the reducing the transmission of the disease, and also on the severity of the disease when you have a second infection. So this is about the breakthrough infection in India. When we see that the total number which has been vaccinated in India with Covaxin is 1.1 crore who received the first doses. About this is 93,56,436, and the positive after the first dose is 4,208 among the first dose vaccinated people. And if the second dose is received in around 17 lakhs 37,178, the positive rate among these population who has received the second dose is around 0.04%, that is 698. So there is very much reduced rate of positivity when we are concerned about after the post-vaccination. So this is about Covishield. First dose who has received is about 10 lakh, and then again the positivity after the first dose is 17,000, and after receiving the second dose is about 15 crores, around 15 crores and 73, 1 crore 57 lakhs, and the positive after the second dose is 5,014. That is the percentage is 0.03%. So this shows that the post-vaccination breakthrough infection is very, very important, because when you give a full dose vaccination and you the rate of infection in them is very less compared to unvaccinated people. Now, what about the COVID-19 and PLHIV? Based on limited data, PLHIV who are on effective ART have the same risks of COVID-19 as people without HIV. The older adults and the people of any age who have serious underlying medical conditions might be at increased risks of severe disease. The PLHIV with low CD4 count and who are not on effective ARV are at increased risks of severe infection. There is no evidence to manage PLHIV differently. There is emerging evidence, it seems, that to indicate a moderately increased risk of death and severity among the COVID-19 people, COVID-19 vaccination in people with PLHIV. Hospitalization risks increase with the disease progression, and those virally unsuppressed, the PLHIV should be prioritized to receive the vaccine. Now, what is the stand for UNH for vaccination in PLHIV? COVID-19 vaccines are approved by the regulatory bodies and believed to be safe for most of the people, including the PLHIV. The COVID-19 vaccine brings same benefit for PLHIV as they bring to all the individuals, and it prevents severe COVID infection and potentially reduces the transmission of SARS-CoV-2 infection. PLHIV should continue to take antiretroviral drugs. Now, how is the efficacy of the vaccine in PLHIV? Two research groups have reported on immune response to the COVID vaccine. The vaccine produced similar immune response to the people with or without HIV. There is some evidence that PLHIV have a weaker or a less durable response to various vaccines, but the quality of immune response produced by any of the COVID-19 vaccine licensed for use is unknown in PLHIV. Now, this is one UK study about the safety and immunogenicity among the PLHIV. 54 PLHIV on ART fully suppress viral load, CD4 less than 350, and comparing with a control group of 50 HIV negative people. And the participants receive 2 standard doses of vaccine, and they are followed for 56 days after their first jab, and blood samples were taken at baseline on day 14, 28, 42, and 56. Now, let us see the result. The antibody response were not affected by the CD4 count in PLHIV. The immune activation in PLHIV did not affect antibody or cell-mediated responses. There is no significant difference in the incidence of most of the common reactions. The limitations are further data are needed for those people who are having low CD4 count below 350, and also for those who are having a detectable viral load. Now, this is another study from South Africa. They have selected PLHIV with a viral load of less than 1,000 copies, and 104 people were enrolled, and with a 70 without HIV control. And the PLHIV had an undetectable viral load and a median CD4 cell count of 695. The study measures the antibody response and safety to the vaccine among the PLHIV, and the result shows that there is no difference in antibody response between PLHIV and the HIV negative persons after the first dose. No difference in the frequency of adverse reaction between the people with or without HIV. Now, are there interaction between the ART medication and COVID vaccine? The answer is no. No pharmacological interaction have been reported between the COVID-19 vaccine and antiretroviral drugs, which people living with HIV should continue to take after the vaccination to maintain good health. There are some claims on social media suggesting that the COVID-19 vaccination could affect the female fertility. Is it true? None of the available vaccines affects the fertility. All the vaccines and their constituents are tested first on animal, later on the human beings to assess if they have any such side effect. Vaccines are authorized for use only after their safety and efficacy is assured. Now, what are the side effects after vaccination? As we all know, there may be some local side effects, and just like mild headache and pain over the side of injection, mild fever or irritability. And there are some systemic side effects like 10 to 35% people can have. 1 in 3 or 4 persons can have these side effects. Very, very rarely, there are some severe side effects like thrombosis or thrombocytopenia syndrome. And the people with HIV did not experience more side effects from the vaccine. It is important to highlight that the benefit of all authorized COVID-19 vaccine in a pandemic context, the currently outweigh from the potential risks of having the infection. Now, who should not get the vaccine? And those who are having anaphylaxis, those who have developed anaphylaxis, and those who are having blood clots like thrombocytopenia or thrombosis. Now, what about the special population group for vaccination? The persons with comorbidities such as obesity, cardiovascular disease, respiratory disease, and diabetes for persons above 65 years of age. The pregnant woman, the risks of developing severe disease compared with non-pregnant women of reproductive age group. The pregnancy is associated with a higher rate of thrombosis and thrombocytopenia and hemorrhage. WHO recommends, but India yet need to release the recommendation for vaccination among the pregnant women. What about the breastfeeding? WHO recommend the use of vaccine among those who are having breastfeeding women, and they also recommend that they should not discontinue breastfeeding after vaccination. Severely immunocompromised persons, the autoimmune conditions, and also persons living with HIV. For persons who have received monoclonal antibodies or convalescent plasma as a part of COVID-19 treatment, the vaccination should defer for at least 90 days. Now, can vaccine be interchangeable? This is not currently recommended for, suppose somebody getting a Covaxin first dose, second dose, Covishield. You cannot do like that. So vaccine interchangeability is there is no recommendation as of now that for interchanging the vaccine. Now, can a person report positive on Dept or RT-PCR after vaccination without active COVID infection? The answer is no. The test cannot be positive without the active COVID infection, cannot be positive because of the vaccine products. The test only picks up the active infection. Now, there are certain situations where we need to delay the vaccination. In case of laboratory diagnosed COVID-19 infection, somebody has got the infection, then we need to defer the vaccination program for at least 3 months after the recovery. In case of COVID-19 patients who has given monoclonal antibodies or convalescent plasma vaccination, they also need to defer the vaccination program by 3 months after the discharge. In case of individuals who receive at least 1 dose and got COVID-19 infection before the second schedule, it has to be deferred by 3 months from the clinical recovery of the infection. So persons requiring ICU or hospitalization for any serious general illness should wait at least for 4 to 8 weeks before the second dose of vaccination. Now, what is the recommendation gap between the 2 doses of vaccination? Covishield about 12 to 18 weeks apart, And we know that the immunity develops after about 4 to 6 weeks, and the Covaxin, 2 doses, 4 weeks apart, and the immunity after about 4 to 6 weeks. Now, do I need to use the mask or other COVID appropriate precautions after receiving the vaccine? The answer is very much yes. It is necessary that everyone who has received the COVID-19 vaccine should continue to follow the COVID appropriate behavior, masks, social distancing, hand sanitization to protect themselves and those around from spreading the infection, because they can always have a second infection. So the key points at the end: COVID-19 vaccine are safe for PLHIV. All PLHIV, irrespective of CD4 viral load, are eligible for vaccine. No difference in the frequency of adverse reactions between the people with or without HIV, and people living with HIV should continue to take the antiretroviral drugs. COVID-appropriate behavior is to be adhered after vaccination. Vaccine is the most effective tool to control the pandemic. Spread the positive message to all. Vaccine prevents severity of COVID-19 illness and also transmission. Sensitization of the community and facilitate the vaccine uptake. Thank you.
Thank you, sir. Participants can unmute their mics now if they have any questions, or even they can chat in, they can type in the chat box. So I don't think there are any questions. Yeah. Any questions from the participants? Please unmute your mic. Yes.
Good afternoon, everyone. Yeah, I just have a query. Like after the first dose of the vaccination for Covishield, 16 to 12 to 16 or 18 weeks gap should be there. Okay, but supposing a person has taken a first dose of vaccination and later on they became infected, and normally when a person get infected, they are allowed to take the vaccine only after 3 months. So will the duration of the vaccine gap be counted from the day of the first dose, or should it be counted from the day of the infection of the person? I hope I'm making my points clear.
Yeah. I understand. We should make the infection recovered completely. From the day of complete recovery, we have to count 3 months. It's not from the first dose.
Okay.
Am I clear?
Thank you. Yeah. Thank you.
For vaccination less than 18 years, there is no recommendation as of now. So in my knowledge, so after few months, it may come up, but less than 18 years, there is no recommendation as of now.
So there's a question in the chat box. Should a patient continue their ART treatment before and after vaccination?
I have already mentioned that ART should not be stopped. And even after the vaccination also, we should continue. And there is no drug interaction between the antiretroviral drugs and the vaccine. So we should not be afraid of continuing the ART.
Any more questions? Please unmute your mics.
Good afternoon, sir.
Yes.
Sir, this thing, a person, a PLHIV on ART, pregnant, if she's pregnant, is she eligible for vaccination?
I have already mentioned about the WHO. There is, in some countries, it is recommended. But in India, it is yet to need to give the recommendation about the vaccination in pregnancy.
Thank you, sir.
Any more questions? So there are no questions. I think we can end the session, sir. Thank you so much. Yeah, thank you to all the participants for patient listening.